Welcome. This is the training video for the CADD PLUS and CADD PCA pump. First thing about these pumps I wanted to explain is the CADD PLUS and the CADD PCA are two different pumps. They look different, but they basically are going to function the same way. As you can see, they have a lot of the same buttons on the same screen: the start, lock, stop, set, clear, select mode, and prime buttons, up and down arrow. So as I teach you on one pump, it will be relevant for the other pump as well. I'm going to do most of my training on the CADD PLUS today, and then at the end I'll turn on the CADD PCA and just show how this dose button works. That's the only difference between the two pumps. Otherwise, as I train through the CADD PLUS, everything that I'm describing on the CADD PLUS will be relevant for the CADD PCA. So let's go ahead and begin. So the first thing about the CADD PLUS pump is this pump requires one 9-volt battery to function. There is no on and off switch on this pump. Basically, when you install the battery, the pump turns on. When you take the battery out, the pump turns off. So there is no on and off switch. So let's start out by installing the battery for this pump. So to do so, flip the pump over to the back. This is the battery door right here. Basically press down on this little button right here and it slides over to the right and it comes off just very easily. I'm gonna go ahead and install the battery. So to install the battery, make sure that you line up the positive and the negative. On the back of the pump right here, it has a plus and a minus. On a 9-volt, it has a plus and a minus. Make sure you line those up properly. When you install the battery, you want to install the battery back first, away from the positive and negative portion. If you try to do the other side, it will not go into place. Just for an example, it will not go in like this. You must install it in this direction first. Once you've installed the battery, you go ahead and hold it down with your thumb. You'll hear a little chirp. That means the pump is powering on and the battery is in successfully. And then we're going to install the door. So to install the door, you basically are going to set the door on the back and it slides on like so. And of course, to the camera. So I'm going to do that one more time from a side angle just so you can see it. So put the battery door on, just like this, and it slides on into place, and it slides into place just like that. And you'll know it's in place because it's a nice flush along the pump, and you can see it's on there flushly. So the pump just did did some turning on for us just then. So the pump has successfully turned on. Once again, there's no on and off switch. You put the battery in, it's on. You take the battery out, and it's off. So currently the pump is stopped. It's showing some values right now. So this is where we would go through and verify what the settings are. Now when I put the batteries in, it did an automatic review, so I'm gonna do this a little bit quicker and put the battery in and then flip the pump over, and it's gonna show us an automatic review of the pump settings. So in a moment, it's gonna run through those settings. 50 milliliters an hour, and res volume 100 milliliters. So currently this pump is programmed for a continuous infusion. Continuous just means it has a volume and a rate. So the patient has a 100 milliliters and they're getting that at 50 milliliters an hour. So I'm going to just show you how to cycle through those settings. So if you want to look at them again yourself, it always defaults onto the reservoir volume. This is the how much is in the bag setting first. How you cycle through them is this select mode. So select the next mode is what select mode means. So I'm going to go ahead and press that once, and that changes to the next mode. And the next mode is the rate. You can see here it says milliliters per hour, ml/HR, that's milliliters per hour, and it's set to 50 milliliters per hour right now. I'm going to do select mode again to show you the next setting. And this is the next setting, which is the amount given. Currently we're at 0 because nothing has been given. You see here in the top right corner it says given. It tells you that this is the amount, the total that has been given so far, and we're at 0 because we have not started it. I'm going to do select mode again, and we're back to the beginning at res volume. So that's how you can cycle through those values and look at the programming. When we send out the pump with the medication on the bag, we will have, I didn't have an example here, we have a label on the bag that will have all of those values on the bag for you, so you'll be able to verify that. We also send out some information as well with this program settings on that. So what I want to do is I'm going to go ahead and look at installing the cassette. So I'm going to set this to the side. So this is the cassette. Now, one thing that we do at the pharmacy that's very helpful for the patient is we will already have taken this cassette and we've already spiked it into the bag, and then we will prime the line. So we get it as ready to go as possible and easy to use for the patient and for yourself out in the home. So the bag will already be out of this bag, it'll already be spiked into here, and then it'll be already ready to go to be put into the pump. So I'm gonna go ahead and do that for you. This is something the pharmacy will be doing, but I'm gonna show you how to do it because it's good information otherwise. So we're gonna go ahead and just open this up. Dispose of the trash. Go ahead and open this up. Dispose of that trash. Okay, so some things to note. When you see this in the patient's home, this blue tab will already been removed. This is basically creating a flow, an open flow. Right now there is open flow through the tubing that allows for priming if you don't have a pump. So the pharmacy is able to prime this line. Once they're done priming, they remove this tab and it closes the line off and creates a flow stop. So right now the flow is open through the line right now with this. So all I'm gonna do is I'm gonna break this away. It's a breakaway tab where you just simply lift it and break it away. So I'm gonna go ahead and pull that off, and then you can discard this. This is now trash. And what that did is that closed the line here. There's this little spring right here. Basically, pressing it down opens it, that's closing it. So it's basically opening it down when it was on it, and it's closed it off now that it has been removed. So what I'm gonna do is I'm gonna go ahead and spike this into the bag. Next piece is this little cap here on the end of this. This is trash, you can go ahead and remove that. Put that to the side. And then we go ahead and spike the bag. So spiking the bag's easy. It's got a little pull tab, you remove the pull tab, and the spike goes in thusly. So we've got that now spiked into the bag. So for the next portion I wanna look at is installing this cassette. This is the pump's tubing, and this is the pump's cassette. So in order to install this cassette, you want to have it the correct way. Now there's basically two steps to this. So the first step is there are two little hinges. You can see this hinge right here, this hinge right here. These hinges go into the pump receptacle hinges, which is this spot here and this spot here. So if you just take it and set that inside there, let me get that a little closer so you can see it. Basically those hinges go into there and clasp thusly. So they just go in and hold into place just like that. Now I normally would have this flat on the ground, have the pump like this, so you can set it in there. And that is now connected, and I know it is because I've done it a few times, but you can see here it is in those little hinges, and if they're not in there, it will not allow the next part to happen. So the next part is locking the cassette in place. So giving it a little bit of press, you want to press it in there. That's why I have it flat on the ground, so while you're doing this, you can have it flat on the ground, just press down on it. But I'm going to hold it like this so you can see what I'm doing. This is the mechanism to lock it in place. Every CADD pump that we send out comes with this lovely little CADD key right here. Here's a CADD key, and you use this to lock the pump into place. So you basically take it and you spin it just like so. So what I did, I'll just unlock it really quick to show you. I just spun it. It's not great for the camera view, my hand's in the way. But basically you take it and you do spin it, lefty loosey, righty tighty. It's the opposite of this one. So right is taking it off, left is putting it on. So you go ahead and, trying to do it with my hand not in the way, it's in the way every time. So you just simply spin it into place, that locks into place. You know this is locked into place because it is relatively flush with the pump. There isn't any gap here. There's pretty much no wrong way to do this. It will not lock into place if you have not done this correctly. And it's sticking a little bit. That's always good for instruction video. There we go, it's come off now. So I'm gonna go ahead and do that one more time. So that's why I hold it down. You just press down on it and then spin it into place to lock it. So cassette is now locked into place. Next thing I wanna show you, on this tubing, there is this clamp. Now most likely, since the pharmacy will have primed the line, what they're gonna do is they're gonna go ahead and have this clamp closed. And that just makes sure that there's no flow going through the tubing. There's now currently a double flow stop happening. This is stopping the flow, and this is stopping the flow. So when you see this, you'll have to release this clamp before you use the pump, because that is stopping the flow right there with this clamp. Okay, so next part is this little end cap here. We can go ahead and remove this. This is to be disposed of. There may be some extensions that need to be installed at this point. I don't have any with me, but if you need to install an extension, it simply twists onto there. And then we're gonna go ahead and we need to prime a little bit. If we're installing an extension, we'll need to prime a little bit, because even though the pharmacy has primed the line up until this point, if you're adding an extension, you'll need to prime that bit through the extension. So we're gonna go ahead and look at priming right now. So I have the pump here. So priming is very simple on this pump. We have prime right here. I'm gonna go ahead and press prime once. So I currently have the pump locked in lock level 2, and in lock level 2 you cannot prime the pump. All you can do is stop and start it. Normally the pump is in lock level 1. I've locked it into the incorrect lock setting for the demonstration right now. So I'm going to go ahead and change that to lock level 1. If you need to change any lock levels around, you should contact the pharmacy and they will assist you with changing those lock levels. It's a special code that we don't want to give out really to anybody, so I'm not going to give that here in the video. So I'm going to go ahead and change it to lock level 1 and then put in our special code right here. And now that it's in the correct lock level, I can go ahead and prime it. So what I'm gonna do is I'm gonna press the prime button, And I'm pressing and holding the prime button. So I'm gonna do that again, basically. You press and hold the prime button. I want to go back to the other screen. There we go. So you're gonna do press and hold the prime button. And once you press and hold it, you see these 3 P's appear. Once all 3 P's have appeared, you're gonna let go, and you're gonna press the prime button again. And you're gonna hold the prime button this time. And while you're holding the prime button, it'll start priming the line. And you can basically hold this for as long as necessary. I was waiting to see some of the fluid coming through to show you it, but it is currently priming. So I'm gonna do that again really quick. I think I just let go of it slightly is why it stopped. You can continue to hold it. And I can see it now coming through the line finally. You can see it on the right side of the screen there. I'm gonna make it so you can see it on the left side when it comes through. And this is one of the reasons why we pre-prime it already. It takes a little bit. So normally if you're priming an extension, it's not that much. It's a lot easier, or much quicker, I mean. And it appears it only does allow priming, so much priming per press, so you'll have to do it a few times. There we go, you can see it now going to the left side. It's at this point here. There it goes. All right, so there's priming demonstration. So if you have an extension, you're only priming a little bit, and it'll be primed through. You'll usually prime till you see about 1 or 2 drops coming out the end. You know that you're fully primed through the line. So as you can see here, priming, we primed 1 milliliter out of the bag, so the pump knows, hey, I've primed 1 milliliter out of here. So that will sometimes happen. What we would do is we normally would overfill the bag slightly. There's a percentage ratio, so we overfill the bags a little bit so that if there's any priming required, the patient still receives their full amount of their dose. So even though this says 99, they're still going to receive the 100 that they needed. That's also why we also pre-prime the bags to make sure that this is correct off the bat. So let's look at the next thing with the pump. It's very simple. So far you got your bags hooked up to the cassette. You've done any priming that's necessary. You've got the patient line here or extension. You're ready to hook that up to the patient, and you're ready to start the pump. So at this point, starting the pump is very simple. Here's your start-stop button. Before I start it, I want to point out on the top right corner here, stop is flashing. For this pump, you know the pump is stopped because stop is flashing. Once we start it, it'll be slightly less clear, but it's clear because you know stop is here for stop. So let's go ahead and start it and see what happens to that stop. Pay attention. Also notice this volume, the reservoir volume is solid and just sitting here. Pay attention to what happens to this as well. So for starting it, you press and hold the start button. So you're gonna press and hold the start button, and it takes about 3 seconds. So I'm gonna start it and then stop it just to show you something. So as you press it, you see these 3 little bars counting down, 3, 2, 1. If I continue to let it go, it's gonna go 3, 2, 1 and start. So press and hold for 1 second, 2 seconds, 3 seconds. So before the pump starts, it goes through a review just to show you this program settings again. And I was quiet there for a minute so you could hear the pump. That is the pump running. So currently the stop is now gone. The stop is now no longer flashing. We now have the res volume is flashing. This is how you know the pump has been started. A lot of times this pump will be used for a very slow rate, and you will not hear the, that is because I have this clamp done. I had a high pressure alarm because I still have a clamp done. So this will come up later about some alarms. We'll look at that in a minute. Let me remove that clamp and then start the pump again. So the pump was having a simulated error that I will do in a minute. So a lot of times the pump will be running at a very slow rate, and you will not hear the pump pumping, or you'll not feel it like I am right now. It'll be very intermittently. So you want to make sure the pump is stopped by knowing that the stop is gone and the res volume is flashing. And the next thing I was going to go over is error alarms. So the first error alarm, the most common one, is the high pressure alarm. And that is basically the pump sensing that there is pressure between the pump and the patient, which is usually somewhere down the line. It can be twisted or kinked tubing. Basically the tubing can get bent in half. Something like this could cause that. So if you have twisted up tubing and it finally gets too twisted and you get a nice actual crease in the tubing, that can cause the high pressure alarm. Another thing can be if this clamp was forgotten to be undone, like I did a moment ago. That will cause a high pressure alarm. But the most common issue with it is that the patient's line has become occluded from sitting too long or for whatever various reasons and needs to be flushed. So I'm going to go ahead and simulate another high pressure alarm by going ahead and closing this off. So you can just see what that looks like. So the pump will continue to run. And at some point it's going to go, hey, I can no longer sense that fluid is going through the line. It's going to alarm HIP, and that stands for high pressure. So I'm going to go ahead and pause it so it's silent for us. So you go ahead and stop that to silence it. You want to find out where the occlusion is happening. In this case, we know it's this little clamp here. Remove the occlusion, and then we can go ahead and start the pump again. And I'm not going to start the pump because that is the completion of this pump. So the only thing I want to show you, last thing, is that another error message that will happen. Basically on the screen here, what you will see is you will see error and two numbers. It'll actually be an E. It'll be the letter E, which stands for error. So it'll say E23 or E35. That error message means to you that you need to contact the pharmacy, instruct the patient to contact the pharmacy, and get a new pump out. Basically, the pump has an internal, basically computer that's detecting what's going on at all times, and if something goes wrong, like the motor having an issue or the screen having an issue or something internal having an issue, it'll alarm with that error code and say, hey, I need to be serviced. So if you're seeing an E23 or E any two numbers, contact the pharmacy, tell them that you're having that sort of an error code, and they will send out a new pump to you immediately. The other error codes, the high pressure one, we can usually troubleshoot those over the phone and get the pump running again. Those ones do not require the pump to be replaced. So let's go ahead and look at the PCA pump really quick. So again, for this to turn it off, you just remove the batteries and the pump is off. If you have to stop the pump for any reason, remove the batteries, the pump will remember exactly where it was in the infusion, and when you install the batteries and start it up again, it'll resume where it left off. So there is an internal memory in here that is keeping track of where the settings were at just a moment ago, and no matter how long this sits, when I put the batteries back into it, it's going to know, hey, I still have that much left to give, and it'll start right back up where it left off. So if the patient has to stop it, disconnect it to shower, or do anything, they can do that at any time, hook it back up, and then start it again, and it'll pick up right where it left off. So let's look at the PCA pump really quick. So the PCA pump, it has a different type of cassette. So the cassette you saw spikes into a bag. The PCA pump has what's called a reservoir volume container. So basically, since this is usually used for pain management meds, the container's in a little more secure device. It's a little plastic box. It's harder to get into and tamper with. So it's already a self-contained unit. This is 100 milliliters, and usually this is sent out at 100 milliliter intervals. There's also a 50 milliliter one, which is half the size. So we're going to use this 100 milliliter one, and this one has for us an example of a programming for you. So it has basically all of those values as I was describing on top of the cassette, so you can see what they are supposed to be programmed as for verifying through the pump. So let's go ahead and install this cassette, turn the pump on, and then start it and look at that. So same thing for installing this cassette. It has the two little hinges, and it has the two little hinge receptacles. So the two hinges go into here as such, and you want to press down on it. So I'm going to try to hold it in place and do it. And once again, you'll need the CADD key. For the PCA pump, it is a special key to keep this more secure, and it requires the end of this CADD key, which is this little special looking device here. So what I'm going to do is I'm going to try to hold it like this. I'm now pressing down on it to hold it into place, and I'm tightening into place. So you know it's on here. If you give it a little tug, give it a little wiggle around, it's nice and secure. You can see it's very, there's a small no gap right here, and it is on here flush, and there's no gap. So this is now secured into place. So let's go ahead and turn this pump on again by installing the batteries. So same thing with the battery door, you press down, slide to your right. Line up your positive with your positive, battery goes in, closes. Same thing, you set your door in place just like so, kind of halfway, and then slides into place like so. And the pump is turning on, so we'll let it do that for a moment. And right now it's going to go through an automatic review. It's basically going to show you all of the program values, one by one, the same thing that the Plus did. And at this point you can verify what the programming is by what is on our label. Currently I'm not programmed what the label is, I have a different programming, but if we can look at it for a moment, we can still look at the relevant pieces. So this is milliliters, 100 milliliters. We've got down here 100 milliliters. Select mode, I'm changing it. This is milligrams per milliliter, which is 5. Down here we have 2 milligrams per milliliter, so it's a little different. This is milligrams per hour. This is your rate. We have 2 milligrams per hour. Down here we have 7 milligrams per hour. Dose, this is your dose amount, so the patient's receiving 1 milligram for their dose. Down here we have 1 milligram per dose, so that one is programmed the same. This is the number of doses allowed. So they're allowed 1 dose every 15 minutes. And if you can see here, we have minutes, 15, that's every 15 minutes they're allowed 1 dose. Down here, we have the same programming. So it's 1 milligram every 15 minutes. And this is another, just a safety check. So it's allowed 4 of those per hour. 15, there's 4 15s in an hour. So they're allowed to get their 4 doses per hour. This is the number of doses given. So this is the number of actual doses that the patient was given, how many times they pressed on this dose button. And this is the amount of milligrams given. So this is how much the patient has received in milligrams of the whatever the medication is. And then we're back to the beginning, the res volume. So for this pump, same thing with the prime. Prime functions the same way. You can't prime and lock level 2, which is sometimes normal because we usually don't want patients to have access to priming with this pump and this type of medication. They just need to be starting and stopping it, so they're not trying to prime an extra amount into there. So if anything is required for that, you'll need to know how to change that around. Luckily with this one, again, we will be priming the line up until this point. So if extensions are required, they'll be put on and they'll be primed at that point. So you have to contact the pharmacy if you need to prime with this pump. So let's go ahead and starting it. I wanted to show you the dose button. So for starting it, same thing, you press and hold start, 3, 2, 1. It's going to go through the automatic review. And once it's done with the review, it's going to start. So notice on the top right corner, stop is now gone and milliliter is flashing. That's how you know it's running. And that's very important with these PCA pumps because they run at a very slow rate and you're not going to know that it's running by listening to it or trying to feel the pump. So far, it hasn't made a sound yet since I started it, and that's normal because it's on a very slow rate with these type of infusions. So you just want to make sure that that stop is gone. So as long as stop is gone, you know you're running. So for our example here, I'm going to go ahead and use this dose button, and I'm going to press dose and let you see what it looks like when the patient's doing a dose. So I'm going to have it here. I'm going to be quiet so you can hear the pump as well. And of course, it is not behaving properly. So me pressing this dose button, it should be giving the dose, and it is not giving the dose. Yes, I know, level 2, we've gone through everything, and dose should be working. So this is a great example for troubleshooting for this pump. Patient says, hey, my dose button's not working. You should possibly also check the dose when you first send the pump out to look at it to make sure it's working, because this dose is not working. So that's actually very good for this situation. Here's another troubleshooting, unexpected troubleshooting. This pump was working when it was placed on the shelf. Again, these are machines, they break down, things happen to them, and usually it happens out with the patients because it just tends to happen that way. I'm just making darn sure that it's not working, and it is not working. I can't describe why right now. Okay, so that was a fantastic example of something that can go wrong. So I wasn't gonna show the high pressure, but the high pressure one, error alarm, my dose button's not working because this is programmed to be working. I don't know why it's not working. I'm just gonna try starting it one more time. And then this pump will be going in for service at this point. And it is registering that I'm pressing the button because the milliliter keeps changing. See, this milliliter is flashing consistently. And when I'm pressing this button, it goes away or stays. So the pump is trying to register the dose is being pressed, but it is just not working right now. So this is a good example of an unexpected troubleshooting issue. So in this situation, we would contact the pharmacy and we'd be sending out a new pump right away for the situation. So we'll go ahead and stop at this point. And I'm going to look at the next portion, so moving along, we're going to go ahead and look at putting this pump into a bag. So what we would do is when we send out these pumps, we would send out this basically nifty little carrying case as well. Let me zip it up like that. So this little carrying case, so I'm going to go ahead and put the CADD PLUS inside of it to show you how to secure that. This is a smaller bag for a smaller situation. We have different sizes of them. So in this one, as you can see, this bag is not going to fit in here, but this is a rather large bag for this situation. But we do have different size ones. I just grabbed this small one for my example here. So what we're going to do is we're going to go ahead and install the CADD PLUS pump in here and then use that for our example. So what you want to do is you go ahead and undo these Velcro straps here and you go ahead and put the CADD, get these all out of the way, put the CADD pump into this portion of it, upside down, and then go ahead and strap it in and strap it in. And then what that did is that secured it in place. And you'll see in a moment, what we've also done is, at any point on the front of this, it has a little Velcro pouch that you can lift up and you can view what the pump is doing. So it's a nice little convenient carrying case. Again, we have different sizes that fits different bags. It's the small one, and I brought a big bag for the small case, so it's not gonna fit in there. Normally the medication would go in the other side of it. So I'm just gonna open it up again one more time to show on the other side of it. There's this nifty little clip right here. This clip would clip onto the top of the IV bag and it would nestle in between these little straps right here. So if I had a 500 ml bag with me, it would just slide right into place into here. And then you can then close it all up together and all be in this one little carrying case. And then just to show you for the line, because you're curious of wondering how the line comes out of it, on this end of it, once you zip it all the way up, it doesn't zip completely all the way and leaves this little basically opening gap right here, and this is where the line would be coming out to go to the patient. Right now I have both of them coming out because here's the bag, and this would be the patient line right here coming out of it. Okay, and that completes our video for the CADD PLUS and CADD PCA pump. All right, thank you very much, and we'll see you for our next video. But before I go, I picked up another PCA pump from the pharmacy just to show you this dose button. So I wanted to go through that before we finish the video here. So we're going to start this pump again. This is a new pump. And I wanted to show you how that dose button works and get a successful dose out of it. So I've got the pump started again. Notice the stop is gone. Milliliter is flashing. It's not making any noise yet because it's running at that very slow rate. And I'm going to go ahead and be quiet and press the dose button. And then it's given successfully a dose. So if you want to verify that the dose is working, usually the patient's ready for a first dose when it's being hooked up, but that is what a successful dose sound looks like and sounds like. And that now completes our video. Thank you, and you see you for the next one.